Symptoms. The symptoms of tuberculosis of the bladder, frequent and painful urination and hematuria, profuse or terminal, and its urinary changes form so essential a part of renal tuberculosis that they have been described in the preceding chapter. Among the other symptoms due to tuberculous cystitis, a partial incontinence of urine from spasm or from ulceration of the neck of the bladder is notable. Stricture of the deep urethra may cause retention of urine. The symptoms of involvement of the other genitourinary organs are sooner or later important. Diagnosis. The diagnosis of bladder tuberculosis belongs even more intimately with renal tuberculosis than do its symptoms. For the diagnosis of bladder tuberculosis is only interesting insomuch as it leads to a diagnosis of the etiological renal or prostatic lesion. Treatment. The first step in the treatment of bladder tuberculosis is discovery and removal of the offending kidney. If there is no offending kidney, or if its removal is contraindicated, or if it has been removed without benefit to the bladder, the direct attack on the bladder begins. Conservative treatment of tuberculosis of the bladder has given far better results than any of the radical procedures that have been employed. Whatever local or operative treatment may be undertaken, hygiene is always the backbone of treatment. Balsamics modify the urine and soothe the bladder. Urinary antiseptics are useless and likely to prove irritating. Tuberculin injections may relieve the symptoms. Local treatment. Local treatment is employed often with great success, but only according to certain well-defined rules. In the first place, gentleness is more essential here than in any other form of urinary disease. In the second place, irrigations must not be used. They are very badly borne by the sensitive bladder and do no more good than installations. In the third place, nitrate of silver, boric acid, and permanganate of potassium, so soothing to simple cystitis, cannot be employed in tuberculous cystitis on account of the violent reaction they provoke, even in very weak solution. This is especially true of the silver salts. Finally, the best rule for local treatment is to use the drug that gives the most comfort, regardless of any curative powers it may possess. The best local application for the tuberculous bladder is carbolic acid, as suggested by Rovsing. But his treatment, irrigation with 5% carbolic acid until the fluid returns clear, is unnecessarily painful. As good results may be obtained by daily installation of 2 to 20 drops of 2% solution into the bladder neck. I have also obtained excellent results with installations of corrosive sublimate. These may be administered daily, 2 to 10 minims to a dose, in very weak solution. Beginning with 1 to 25,000, the strength of the solution is increased as far and as rapidly as the patient's symptoms permit. The treatment should excite no sharp reaction. Collin employs the following. Chetwood has used 25% to 100% solutions of guaiacol valerianate in olive oil and 3% to 12% watery solutions of phthalate sulfate. Gomenol is well spoken of. Surgical treatment. If the agony of severe tuberculous cystitis is not relieved by such measures as are detailed above, it may be instantly relieved by lumbar nephrostomy of the remaining kidney.